Yes. I was just telling the audience that you had one of the most extraordinary diagnosis stories that I'd ever heard, that you actually were diagnosed some 6 hours after you'd given a presentation about a cancer treatment that has since been approved by the FDA, and I was wondering if you could tell us about that experience.
Yeah, well, first of all, it was presented by someone else, but it was the same day. And drug discovery is very hard, and it's really a clinical career to have any drug approved. And so it was really going from the highest of highs in one day to the lowest of lows. And so it was an incredible experience.
And how do you think you experienced your diagnosis, having been a researcher in this very field? How did that change that experience? Have you talked to? Do you know of other scientists who have had this same sort of bizarre experience that you've had?
Oh yeah, definitely. We tend to congregate together. There's a lot of patient groups online where we meet each other, and the scientists definitely congregate together. And it definitely is a different experience. How I experienced it was first my diagnosis hit as a human being, but within a couple hours I really began to look at it as a scientist and look at it as the greatest scientific research project of my entire life.
Yeah. How is your treatment going now?
Right now, I was diagnosed 5 years ago, so I've gone through a lot of the standard treatments, and we're starting to kind of run out of standard treatments. But I have definitely some tricks up my sleeve, and so right now I'm hanging in there.
Recent research suggests that younger people like yourself, are being diagnosed with colon cancer at higher rates than before. Why do you think that is?
There's definitely, statistically, there's been an explosion in the rate of growth of early onset colorectal cancer, so before the age of screening. I personally don't think it's due to genes changing in the past 10 to 15 years. And so I think it's probably some sort of sociological cause, whether it's some mixture of lifestyle or eating habits, processed foods, or environmental. There's a lot of very important research going on right now to figure that out. But definitely, there's an explosion in early onset CRC right now.
Where is that research being done? Are people looking into that actively?
Oh, they're looking at it very actively in a lot of academic centers and a lot of cancer centers, because it really is striking how the statistics are changing. And what's really sad is that because of PCP, when someone presents, for example, GI symptoms, if they present any symptoms at all, colon cancer isn't the #1 thing on the list if someone walks in and they're 30 years old. And so a lot of times PCPs put off checking for colon cancer. And so younger colon cancer patients tend to be diagnosed at a later stage when they're already metastatic. So the death rates and the prognoses of early onset CRC are actually significantly worse than CRC patients of an older age.
Now, Tom, you write a blog about your experience with this disease, and quite a good blog, if I don't say so myself. And I just wanted to ask you about whether that has had therapeutic value, or how does expressing yourself through writing, how has that helped you manage this experience?
Definitely has a lot of value for me in addition to my readers. On one hand, it's cathartic. I write some very personal posts about my own treatments and my own disease. But also, I get a lot of value out of helping others. And so how I set up the blog was, I knew I had a unique viewpoint of being both a patient and a scientist. And both patients and scientists work in cancer every day, but they still don't talk to each other. And so I alternate posts between science-based posts to explain science to fellow patients in easy-to-understand layperson terms. But then I also write very personal patient posts that kind of explain the patient experience with my fellow scientist readers. And so it's, I think both sides of the spectrum get a lot out of my blog, and it's really struck a nerve. It was meant to be a small blog, but it took off beyond my wildest expectations, and it now gets tens of thousands of hits each post in 150 countries, and it's been translated into 6 languages.
And as I understand it, there's been quite a large community has grown up around this blog. Can you tell me a little bit about that and what that has meant kind of to the patients that are a part of that community?
Yeah, so what happened to me when I was first diagnosed was I realized that clinical trials were a necessary part of my own treatment plan. And so I went to clinicaltrials.gov and searched colon cancer clinical trials, and I got 1,200 hits. And I didn't know as a cancer researcher where to start with 1,200 hits. And so I recognized that if I had trouble, imagine a cancer patient with no scientific background in a panic situation, how they would approach clinical trials trying to find one. And so I set up a personal blog to help patients out with information. But I realized that a personal blog has its limitations, even if it's a big blog. And so I searched out communities to collaborate with to kind of help me get out the word on clinical trials to fellow patients.
And has it been your experience, do these communities meet offline and online, or is this strictly on social networks or around things like your blog?
They're primarily online, and really the social media revolution has revolutionized being a cancer patient. It's changed the game completely, where now thousands of patients can get together, much larger than a community a group can be, and exchange information and support each other. It's really been an amazing transformation in the past 10 years.
Now, I also know that you started this search engine for colon cancer patients who are looking for clinical trials. And I wanted to ask you, so someone with your very specific set of skills could have done a lot of different things when it comes to colon cancer. Why did you choose that?
Well, it really came down to there's a lot of fantastic, smart scientists already working on colon cancer in the lab. And so I was looking at both need, and once again going back to those 1,200 hits and not knowing what to do with them, which demonstrated need, and what I could bring to the table, having a unique perspective of both being a patient and a scientist. And so I really thought I could bring to the table something that's unique in that bringing clinical trial information to fellow patients. And so I really did that via two means, two different collaborations. First was doing a curated clinical trial finder with Fight Colorectal Cancer and Flatiron Health, where it brings down this 1,200 hits down into a more manageable number because it's curated. And then working with Colontown and co-founding a clinical trials group on Colontown, which brings in the social media aspect, where people can talk about clinical trials and CRC for 24 hours a day, 7 days a week, worldwide. We have close to 1,000 members. And importantly, we bring fellow scientists on board, professors of immunology and genetics and clinical trial specialists, to explain in layperson terms to fellow patients how clinical trials work logistically and scientifically. And really the two pieces are meant to work together coherently so that a patient can go to his or her medical oncologist with basically a small number of clinical trials on a silver platter that they have a basic understanding of, that they can then have a medical discussion with their medical oncologist of what is the best trial for them.
Has that model been replicated by other types of patients with other types of cancer or other types of diseases? I'm
actually very glad you asked that question. It hasn't been, but there's nothing colorectal cancer specific about either activity, either the social media clinics group or the curated clinical trial finder. It can be done for any cancer. And so really my personal goal is really to now expand it beyond colorectal cancer into other cancer types. And I'm now in active discussions with multiple other advocacy groups for different cancer types, and I would love to see it spread to other cancers through other activists and other advocacy groups, because I think both methodologies are both potentially really game changers.
Tom, before we go, I was wondering if you could tell the audience if you were to meet somebody, and I'm sure you often do, who is like yourself, a young person diagnosed with colon cancer, what would you tell them? What would you tell them to do in the first week, in the first month?
I tell them first to take deep breaths, calm down. It's a marathon, not a sprint. It's a cliche in cancer circles, but it's so true. And also that, speaking as a scientist, there's amazing things coming down the pipeline from the various labs, both academic as well as from the biopharmaceutical industry. I've seen with my own eyes things that will just blow the socks off of people. And so I tell them this to find ways to hold on because there are going to be major treatment improvements within the next 5 years.
Tom, thank you for being with us today. It's a real pleasure.
Thank you very much.